Good morning, everyone. Thank you very much for joining us today. Welcome to Medicare 2020, our webinar on Medicare open enrollment and changes for the 2020 calendar year. And with that, I'd like to introduce our featured presenter today. Julia Jennings is an account executive with Sylvia Group, specializing in Medicare and retiree-based insurance. She's semi-retired herself after a 32-year career with Sylvia Group as Vice President of Employee Benefits. She is Executive Director of the Massachusetts Association of Health Underwriters and has served on the national board on a state, regional, and national level. She lives in Rochester, Massachusetts with her husband, Dave, and their Airedale puppy, Charlotte. Julie, take it away.
Okay, thank you, Vin, and good morning, everyone. Thanks for taking time out of your day to join the webinar. Just a brief agenda for today. We're going to talk about a little bit of Medicare background and then go into the parts of Medicare. There's Part A and B, which are referred to as original Medicare. We have supplemental insurance for the original Medicare, Part D prescription drug plans, Medicare Advantage plans. We'll touch on how and when to enroll in Medicare, some information about annual enrollment and special enrollment periods, and time permitting, we'll share any additional information that we can with you. Then I believe that we have the chat log going today.
People can submit questions during the presentation, and if time allows at the end, we'll address those questions at the end of the presentation. If we're short on time, please submit your questions online, or you can email them, and either I'll relay them to Julie or you can email Julie directly. That information will be at the end of the presentation as well, and Julie will get back to you with the answers.
Okay, thank you. So let's dig right into it. Some of this may be remedial for some of you, and I know that we have some participants that are getting ready to go on to Medicare. So there's a little bit of, apprehension in terms of what Medicare is and what it isn't. We're not talking about Medicare for all today. That's a political discussion for another day. But Medicare is the health insurance for United States citizens and legal residents of the United States who've lived here for 5 or more years, who are 65 or older, or who are under 65 with specific disabilities that are covered under the Medicare Act. That's someone who's receiving Social Security disability income for a period of 24 months will become eligible for Medicare at that time. Someone who is immediately, or as soon as someone is diagnosed with Lou Gehrig's disease, that allows for eligibility for Medicare. And lastly, for someone who has end-stage renal disease, which is permanent kidney failure on dialysis, that would allow you to join Medicare as well. Today, we're going to focus, though, on the act of turning 65 and celebrating that landmark birthday. So who are the players in terms of administering Medicare? There's actually the Social Security Administration, which handles enrollment, premiums, and ID cards. So for most of you, when it comes time to enroll in Medicare, you're not enrolling through the Centers for CMS, through Centers for Medicare, but through the Social Security Administration. Or if you are a railroad employee, then you would enroll through the Railroad Retirement Board. The Centers for Medicare and Medicaid Services, CMS, is really the entity that administers the entire program of Medicare. So not the individual enrollments, but what the eligible coverages are and how they're paid and so forth. Notice also that CMS is for Medicare and Medicaid. So I just want to make a distinction here that Medicare, as I said, is for people primarily who are 65 or who have certain disabilities. Medicaid is a program that refers to the program that offers people benefits based on financial need. So they're two different things. A lot of times I hear people say, oh, I've got to sign up for Medicaid. when really what they mean is they're signing up for Medicare. So there are 4 parts of Medicare. Part A is hospitalization insurance. Part B is medical insurance. Part C, which is Medicare Advantage, and Part D, which is prescription drug coverage. The reason that there are these 4 parts is really that Medicare coverage has evolved since 1965, when President Johnson was the first president to sign Medicare benefits into law. And since then, we've added pieces onto it and we've changed things. So, for example, in 2006, the Medicare Modernization Act was passed, and that's when we started offering the prescription drug coverage as part of Medicare. Does confuse things, though, I think, when we're putting things together as opposed to just like making one full program. So hopefully today you'll have a little better understanding of how things work. Part A, medical hospital insurance, is for covering inpatient hospital care, inpatient skilled nursing care, specifically after you've been hospitalized for 3 days. So not for someone who just goes into rehab, but first goes into hospitalization. Covers inpatient blood, outpatient home health care, and hospice care. It's important to note here things that are not covered under hospital insurance Part A, and that would be private duty nursing, private rooms, and then personal care items such as television, phone, razors, slipper socks, etc. In 2020, and every year actually, the premium and deductibles under Part A Medicare change. So first of all, if you have worked for 40 quarters and paid into Social Security for that time, so 10 years, then you will have no premium for Part A. That's because they've been taking Social Security taxes out of your payroll for those 10 years or more. If you have 30 but less than 40 quarters, the standard premium for 2020 will be $253 a month. And if you have less than 30 quarters, you can buy into Medicare Part A for the bargain price of $460 a month. So as you can see, it's very expensive if you don't have your quarters. If anyone that you know is approaching Medicare age and there's one of them has, one spouse has quarters and the other doesn't have enough quarters, that spouse that doesn't have the quarters will be eligible for Medicare based on their spouse. So there's some crossover benefits there. In 2020, the Part A hospitalization deductible is going to be set at $1,420. That deductible is a one-time deductible that applies for inpatient hospitalizations up to 60 days of inpatient care. The thing to understand with the way that this deductible works, however, is that if you go into the hospital and you go in, let's say for 5 days, you have a $1,420 deductible that is your responsibility. You leave the hospital and 6 months down the road, you go into the hospital again. Could be for something related and something totally unrelated. It doesn't matter. You will have another deductible. So anytime that you have a hospitalization that is separated, or 2 hospitalizations that are separated by more than 60 days, that's going to trigger another deductible, even though it might still be in the same calendar year. If you are inpatient for more than 60 days, there is a daily copayment, and this is tentatively set at $355 per day. So in other words, you'd be paying that amount for up to 30 days if you were in the hospital for that long. And then beyond 90 days, a $710 copayment per day. After 150 days of inpatient hospitalization, your inpatient benefits are exhausted under Medicare Part A. There is no out-of-pocket maximum, which means that there's no limit to how much you will pay in those daily copayments. It doesn't shut off at some point the way that your traditional health insurance would, let's say in your employer-sponsored plans. Excuse me. So moving on to Part B, medical insurance. This is a lot of your outpatient services. So doctor services, outpatient medical and surgical services, diagnostic lab tests, durable medical equipment, diabetic testing supplies, all fall under Part B. Excuse me. Go get my flu shot soon also. Your Part B medical insurance, however, does cover flu shots, covers a yearly wellness visit. Yearly wellness visit is not the same, however, as a routine physical exam. So people are often surprised because our health plans, again, under 65, we're used to having physical exams covered in full, a lot of times including routine eye exams, and these are not covered under Medicare Part B. Also under Part B, home health care is covered when it's not preceded by a hospitalization or when the hospital benefits are over. I see a glass of water coming in to rescue me. Thank you. So what are the costs for Part B in 2020? The monthly premium for Part B is tentatively set at $144.30. In 2019, it was $135, so it's gone up by $9, or will go up by $9 in 2020. This increase applies to those people who are new to Medicare or who are not yet receiving Social Security payments. So for some people, the rate will not go up or it won't go up as much. You might be paying something different. Premiums do represent about 25% of the total cost. So the federal government is contributing 75% of the cost of medical coverage. That $144 is obviously not the full cost of providing care to seniors. So the government is chipping in a big percentage of that. Anyone who's earning higher incomes will pay an additional income-based premium for Part B that's fondly known as IRMA. And some Social Security beneficiaries, as I mentioned, may pay less than the standard premium because we do have legislation that protects people from increases that would result in a decrease in their monthly Social Security benefits. This is a chart showing what the IRMA, the income-related monthly adjustment amount, is expected to be in 2020. We also show you what it currently is for 2019. One thing that's happening starting in January 1st of 2020 is they're now going to index the income level brackets. So in 2019, seeing that first category of $87,000 or less, that amount was $85,000. So that's a good thing. What it's doing is it's allowing for, based on the cost of living projected increase, which is, I believe, 1.9% for 2020. They're going to increase the income levels so that the penalty will apply to higher incomes as incomes grow due to increases in cost of living. But if you look down the chart, you can see that whether you're single, filing individually, or married filing jointly, the higher your income, you can be paying a lot more than the standard premium for your coverage. What Medicare uses for determining your income is actually your income from 2 years prior. So in 2020, they're going to be looking at your 2018 tax return to figure out, whether you are responsible for paying this IRMA, and they'll be sure to send you a bill if you are. If you do get a bill for IRMA and you think that it's incorrect or your income is inflated for specific reasons, like a one-time event of getting a retirement bonus, let's say, or something like that, then or a sale of assets, then you can appeal the IRMA for that year. And if anyone's in that situation, you can always let us know and we can help you, or talk to your tax professional. So one thing to remember is that premiums can and do change just about every year. Also, if you don't sign up for Part B at the right time, you will have a late enrollment penalty. And that penalty is a lifetime penalty. So it's very important that you ask the questions, that you know whether to sign up for Part B, that you get a knowledgeable response to that, so that you don't end up finding out after the fact that you are a late enrollee and that you're going to be paying that 10% penalty for every year that you've delayed signing up for Part B. Also to know, if you have limited income and resources, you may be eligible for assistance in paying for your premium. So when we talked about the Part A and B insurance, we talked about a pretty hefty deductible of $1,420. Your Part B has a deductible of in 2020 of $197 and 20% cost sharing. All of these expenses can really add up. So most people who go on Medicare will want to have something that supplements that. And there is coverage that we refer to as Medigap or Medicare supplemental insurance. So this is not coverage by the government, but it's something that wraps around your Part A and B coverage. It is private insurance. You have to be enrolled in both Part A and Part B to be eligible for and to purchase supplemental insurance. There is a monthly premium to pay for this coverage. It does help to pay your health care costs, including the deductibles and co-payments that we mentioned that Medicare doesn't cover. One thing that people really like about going this route is that with a Medicare supplement plan, you can see any provider who's contracted and accepts Medicare. And the way that works is that you present both your Medicare card and your supplemental insurance card. Medicare gets the bill first. They pay its share of whatever is approved Medicare amounts. And then the bill travels over to the private insurance company, the supplemental insurance, and they pay the balance. There can be some out-of-pocket costs to you depending on which supplemental insurance you purchase. Another really attractive feature of Medicare supplement plans is that they really are national in basis because eligibility or access to doctors is based on whoever accepts Medicare. So you could be in Massachusetts for 6 months and be in Florida or Arizona, wherever it might be for the other 6 months, and your coverage is not going to change. You can have providers that, as long as they accept Medicare in the states where you are, then you can have coverage there, and you don't have to worry about getting home to see a doctor for for certain medical situations. So the portability is really nice. And if you change residence, let's say that you decide that for tax reasons or whatever, that it makes more sense to live in another state, then you don't have to change your insurance. Your Medicare and your supplemental insurance goes with you. That's not the case for some of the other insurances that we're going to talk about today. So Medicare supplement insurance in Massachusetts, there are only 2 supplemental plans that are approved in the state. So I'm not talking about insurance carriers, but I'm talking about the actual plan benefits. One is called the Core Supplement and the other is called Supplement One. The Core Supplement will pick up some of the deductibles and co-payments and co-insurance, but it doesn't cover everything. So it does not pick up the Part A deductible, that $1,420 I referred to. Doesn't cover the skilled nursing facility daily co-payments, which can really add up also after the first 20 days. Those skilled nursing facility co-payments are $177 a day in 2020, and the Part B deductible is set at $197 for 2020. So the Core Supplement does cover some of the Medicare out-of-pocket costs, but not all of them. The Supplement One plan is really the sort of the Cadillac plan. It pays all of original Medicare's deductibles, co-payments, and co-insurance, with one exception. Anyone who is newly eligible for Medicare starting 1/1/20, so anyone who's born after January 1st of 1955, your Supplement One plan cannot pay your Part B deductible, that $197. If you were born prior to that date, then you'll be able to continue to have a plan of supplement. This is a new was legislation that was passed, federal legislation that was passed in 2018 to take effect in 2020. Basically, the federal government decided that it doesn't make sense to offer people a plan where you have no skin in the game at all. So their decision was that that plans can no longer cover that Part B that outpatient doctor deductible in the future. But if you already have it, or if you were eligible to have it by your date of birth, then you'll be able to continue it until further notice, until another law is passed or whatever. So other than this core plan and supplement plan, other than those changes in deductibles, the plans are very similar. They're all based on Medicare. So Medicare is the one that calls the shots to say what's covered and how it's covered. And it doesn't matter whether you buy a Medicare supplement plan from company A or company B. For example, we within our office, we have the Harvard Pilgrim plan, we have the United Healthcare plan, there's the Blue Cross Medics plan. All of those plans, no matter which one you purchase, the network doesn't change, the benefits don't change. They're standardized plans that are basically they're the people that process the claims. So that's important to notice, because a lot of times people will say, oh, I want this plan because my sister had this plan and it's great. They should all be paying on the same level. So moving on to Part D prescription drug plans, I mentioned earlier that these plans were initially put into place in 2006. And so prescription drug coverage is really mandatory for anyone who is on Medicare. If you don't have it and then you get it at a later date, you will pay a penalty, which we'll cover in a few minutes. So the eligibility for Part D or prescription drug is based on you must be enrolled in Part A or eligible in Part B for Part B. Part D plans are private insurance plans. So even though the federal government makes it sound like it's a federal program and they dictate what those plans are like, they're offered by private insurance, prescription drug companies, formularies, pharmacy benefit managers. There's about 28 plans that are offered in the state of Massachusetts. Many of those plans are national in scope, so that if you are a snowbird and you go, to another state for part of the year, you still maintain your residency here, then you're going to be able to still fill your prescriptions out of state without a problem. Part D plans are purchased on a standalone basis. If you have original Medicare, when we refer to original Medicare, remember that's Part A and B. You probably have a Medigap or a Medicare supplement. And then you want that fourth piece, which is the prescription drug coverage. If you were to purchase, instead of a Medicare supplement, you purchase a Medicare Advantage, Part D plans are most often included as part of that Medicare Advantage plan. So they're packaged together. For 2020, your Part D plan can have a deductible, though not all plans do have a deductible. The deductible cannot exceed $435 for 2020. So in 2019, the maximum was $415. As I said, not all the plans do have a deductible, or some of them will have like $150 deductible, something less than the full maximum. Oftentimes we'll see that plans will not, even though they have a deductible, the deductible will not necessarily apply to generics. So some people who have very low prescription drug needs, maybe only take a couple of generics, might be fine with a plan with a $435 deductible, because the premiums are less and it works for them. So that's part of the discovery process that you want to look at, is what your medications are and how much they're going to cost for the different plans in 2020. After the deductible, there's something that is referred to as the initial coverage level. And during that level of coverage, you may have co-payments, or you may actually have co-insurance. So that, the plan might say that you're paying, 20% for generics and 30%, let's say, for brand names or something like that. Or it might be you're paying $15 in this tier and $30 in another tier, and so forth. There is something that some people refer to as a donut hole at the end of the initial coverage level. So that is triggered when your when the total cost of drugs reaches $4,020. And again, this is the amount that is set for 2020. So the total cost of drugs means not what you pay, but what the total cost is between what you pay, what the pharmacy plan pays, what you pay in deductibles and so forth. And once it reaches that 4,020, you go into the donut hole. Originally, when Medicare Modernization Act was passed back in 2006, the donut hole was a big hole. You had to pay all of your drug costs during that coverage gap period. That donut hole has been shrinking over the past several years, and partly because of the Affordable Care Act. When that was passed, it allowed that coverage gap to reduce every single year. So in 2019, this year, in the coverage gap, members would pay 35% of the brand name drugs cost, 41% for generics. And in 2020, it's reached that final phase-in so that members will pay 25% for both brand name and generic drugs. It won't reduce anymore after this year without additional legislation. But in 2020, your cost sharing in the coverage gap will be the lowest it has been. It's really gone from 100% cost sharing down to 25% in that period of time. Once your costs reach $6,350, which is referred to as the total out-of-pocket or the true out-of-pocket cost, you'll then be in what they consider the catastrophic level. So instead of paying 25% of your drug costs, you'll revert back to a very small copayment for the rest of the year. However, that out-of-pocket limit is quite extensive at $6,350. So just additional information about Part D plans. Excuse me, before I start coughing again. Plans do have formularies, which is basically the name for a list of covered drugs. There are protections within the Medicare law to make sure that each formulary has drugs in every classification. So you can't buy a plan that says something like, well, we're not going to cover cancer drugs. There is extra help to pay for Part D if you have limited income. And on the flip side, anyone who earns higher incomes, similar to the chart that I showed you on Part B, will have to pay higher premiums for Part D insurance. If you don't sign up for Part D, which has happened, sometimes people will say, well, I don't take any medications, so I'm not going to get a Part D plan. The problem with that is that our health can change over time. And once you've declined to get Part D insurance, and then you decide that you do need it in the future, the penalty is calculated. It's a lifetime penalty. It's calculated based on 1% of whatever the base premium for that year is, 1% per month of not being covered on a Part D plan. So if you've delayed signing up for Part D for 5 years, that's 60 months, you're going to pay a 60% penalty on what is considered to be the average Part D premium for the year. So it can be quite extensive. My advice to everyone is, even if you're not taking prescription drugs, there are some very low cost prescription plans. Part D plans, premiums for have been pretty minimal. Like you can get a plan for $14 a month. So it's really better to have some insurance than no insurance, because it could end up costing you a lot in the end. So moving on to Medicare Advantage. What is Medicare Advantage? It's sometimes referred to as Part C, which is just a throwback to the Medicare legislation that enabled Medicare Advantage plans to be offered. And really what we're doing in a Medicare Advantage plan is we're taking that Part A hospital insurance and Part B medical insurance, and we're packaging it with a private insurance plan who is going to agree with the federal government to take care of all of your medical needs under plan. They're private insurance approved by Medicare. There's usually a network involved, and the network of doctors, hospitals, and other providers might not be the same as the plan that you had as let's say, an employee of your employer. So it's important to really look at the network because they could be much more restrictive than you would think for the name of the plan that you purchase. There are HMO plans, and under the HMO plans, you must get referrals and stay within the network for coverage. There are also PPO type plans where you can receive treatment out of network, but you'll have a higher cost to pay for it. If you join a Medicare Advantage plan, you're still considered to be part of Medicare, and so you have all of the rights and protections of Medicare. The Medicare Advantage plan has to provide minimally the services that are covered by Part A and B, but in this instance with Medicare Advantage, the private insurance plan is covering those services instead. They might be covered with different copayments and different deductibles and so forth, but they have to cover the same services. You can't be charged more for certain services than original Medicare, so there's a list of services that they have to provide certain coverage for. There is an out-of-pocket limit on Medicare Advantage plans, which is really important because when you look at a Medicare Advantage plan and you see all of the copayments, there could be a daily copayment for hospitalization, for lab tests, for doctor's visits, for outpatient diagnostics, etc. They could be quite extensive. So that out-of-pocket limit is really important because it protects you and limits the amount that no matter basically how much medical care you need in a year, it can't exceed that certain out-of-pocket limit. But again, those out-of-pocket limits are not necessarily low. You really have to look at each Medicare Advantage plan to see which one makes sense for you. Most Medicare Advantage plans include some really nice preventative benefits. They cover, routine physical. They cover eye exams. They often cover eyeglasses, preventative dental services. They can cover acupuncture. They can have cash benefits for to use with over-the-counter medications. So there's a lot of bells and whistles that apply or that are incorporated into Medicare Advantage plans that you're not going to see in Medicare supplement plans. But the trade-off is that you're also going to have a lot more copayments maybe that you would have between getting a Medicare plan with supplemental insurance. You cannot purchase a Medigap policy and a Medicare Advantage, so you can't use that to supplement your Medicare Advantage plan. And you still need to pay your Part B Medicare insurance, even though you're technically not submitting claims through Medicare. You are responsible for that. So there's tons of ads on the television because we are in the annual enrollment period starting today through December 7th. And you will see plans that are advertised with all these extra benefits. They sound very attractive. You'll also hear about plans that will be advertised as zero premium plans. A zero premium plan means that you will pay no more for your premium. In addition to, you still have to pay your Part B. So it's zero additional premium really is the way that should be advertised, I think. But so let's talk about enrolling in Medicare. And the rules that apply to your Medicare enrollment can vary depending on your circumstances. So if you're receiving Social Security disability insurance, I had mentioned at the beginning of the program, you can enroll in Medicare and you'll be notified then that you are eligible for Medicare after 24 months of receiving Social Security disability income. If you're receiving Social Security, you've taken early Social Security, you can collect as early as age 62 for normal or for a reduced amount of Social Security, then you're going to automatically be enrolled in Medicare at age 65. You can, if you're not in that category, you're not receiving Social Security when you turn age 65, you can enroll in Medicare depending on your circumstances. You may postpone that if you have coverage, you're still working and you have coverage from an employer. And also impacting that is your eligibility could be based on whether you've been diagnosed with end-stage renal disease. So as I mentioned, there is an automatic enrollment in Medicare for someone who's already receiving Social Security or railroad benefits. They will send you a packet of information about 3 months before you turn age 65, or they'll automatically send you something after receiving Social Security for 24 months. You will receive a Medicare card. And if you don't want Part B at that time, because you have other insurance, for example, then you can complete the back of the card and mail it back into them to say, I don't want this now. If you're not signing up for Social Security at age 65, you're not going to automatically be enrolled in Part A and Part B. So you have to take the initiative to enroll. You go to the Social Security website, which is ssa.gov. As one option, and you can enroll that way. It's very easy to do it. We're happy to help anyone who is at that point. You can call Social Security and enroll. I don't recommend that you just go down to the Social Security office. They're known to turn people around from, if you don't have an appointment, and they're not going to make an appointment with you unless you first called Social Security so that they can schedule a preliminary phone appointment before they tell you that you should be then scheduling an appointment at the local Social Security office. So if you can go on to, I just helped someone a couple of days ago who went onto Social Security website to enroll in Medicare, and because he didn't have enough quarters to qualify for Medicare, they said that he had to, call them. So he called them, and they confirmed that through his wife that he had enough quarters. And so now they're moving on to the next step. But it doesn't work well if you just think, oh, I'm just going to go down to the Social Security office. You're going to wait in line, and you're probably not going to be satisfied with what they tell you after waiting in line. So it can be pretty frustrating. So there are different times that you can enroll in Medicare or change how you get your coverage. And one of those times that we're in right now is the open enrollment period. But I'm going to talk about all four of these: the initial open enrollment, general enrollment, and special enrollment. So let's start about initial enrollment period. For those of you who are on the call because you know that your birthday is coming up, let's say in the next year, and you want to make sure that you do the right thing. The initial enrollment period starts 3 months before the month in which you turn 65. So if your birthday is in July, then your initial enrollment period is actually going to start on April 1st. So April, May, and June are the 3 months prior to July, which is when your birthday is. And then let's say that your birthday is July 7th. Your Medicare eligibility is always going to be on the first of the month. So it would be July 1st is your eligibility. But if for some reason you miss signing up for it ahead of time, that initial enrollment period extends for an additional 3 months after the month of your birthday month. But your coverage will be delayed. So if you sign up a month late, you're gonna you're not going to start at age 65. They won't make it retroactive. So that's the 7-month period of your initial enrollment period. As I mentioned, it starts 3 months ahead of time. And so what we do often is for our clients who know that they want to sign up for Medicare, we'll, and work with us, then we'll put that date into our computer to make sure that we help you, that we reach out to you in advance to help you sign up. So there's something called a special enrollment period, and this is really what applies to people who postpone getting Medicare because they have an employer sponsored plan and they're working beyond age 65. So the special enrollment period is the 8 months after your employer group plan ceases. One thing that's very important to note here is that COBRA is not considered active current employment. So you don't want to wait until, let's say that you retire at age 66 and you take COBRA and then you sign up, you decide that you want to stop COBRA and sign up for Medicare when you're 67. You will have exceeded your 8-month special enrollment period and you will be considered a late enrollee for Medicare and you will be assessed a penalty. So we really want to make sure that that doesn't happen. As long as you notify Social Security that you want to enroll in Medicare within the 8 months of losing your active employment-based insurance. There's also a note here, let's see, if you enroll during that special enrollment period, you can get a Medicare Advantage plan at that time, a Part D plan, and that's based on 6 months from Part B. So those time frames sort of coincide with each other. Something called the general enrollment period, and this really is for someone who's just totally missed the boat when they were supposed to sign up for Medicare. And they can't just say, you know, geez, I should have signed up for Medicare. I'm going to do it now. There's only one time a year that you can do. The general enrollment period is the first 3 months of each year with coverage beginning on July 1st. So if you miss the boat in terms of signing up, then you're going to have to wait to get that coverage until the general enrollment period. This year, just within the past week, actually, the Medicare website has rolled out a new search tool. In the past, there was a Medicare Plan Finder that we used, and it's still called Medicare Plan Finder, but they've made some improvements to it to provide more information for beneficiaries, and it also links into your personal information. So it's a little bit more intuitive to your circumstances. There are training sessions going on right now. So I have to say that while I've been very familiar with the Medicare Plan Finder in the past, helping people look for Part D plans, for example, I'm still getting up to snuff on these, and they're still rolling. They're also still finding a few glitches in the program to make it work better. The first version of it that came out, they got a lot of feedback from users saying that it just wasn't user friendly, but mostly that it wasn't giving people the information that they want to know, and so they had to go back to the drawing board. And it has just been released, so I'm going to look forward to using it. And I might not be an expert at it today, but I'll tell you that within the first week of using it, I'm sure with our clients needing help that we're going to get familiarized with it really fast. In order to use the Medicare Plan Finder and get the best quality information, we're going to need to know the prescriptions that you take, and that means the name of the prescription, the dosage, and the frequency. You'll be able to put in like what pharmacy you like to use and make sure that whatever plan you choose, that pharmacy is included, or especially if there's a preferred pharmacy benefit, that you're in a preferred pharmacy where you're going to have lower copayments. You'll want to make sure that you have coverage in multiple states if you travel during the year. There are star ratings on the prescription drug plans that let you know the quality of service and feedback that each plan is rated on, and what plan is going to be the best overall price for you. So in addition to knowing how much the insurance costs every month for the prescription plan, you'll be able to see what your copayments are and what your total costs will be. Just to let you know where we fit into the whole process. We are licensed and certified insurance professionals, so we're knowledgeable about individual insurance. If you're coming off of your employer plan and you're not yet 65, we can help you with continuation coverage. We can help you compare your plans. prescription drug plans, Medicare Advantage plans, supplemental Medigap plans. Sometimes people also want to purchase additional insurance. They're losing their dental insurance, their vision insurance, their life insurance as a retiree. That's part of the process of evaluation that we can help you with, basically to transition you from your employment status to whether you're part-time, full-time, retired, getting the coverage that you need and that makes sense. And that doesn't always stay static, so it might change from year to year. Also, if you are concerned about protecting your savings from long-term illness, we offer long-term care insurance evaluation for whether it makes sense for you. We do have a seminar on the evening of November 7th that we'd love to send you an invitation to, and we'd love to see you attend, or you can give us a call if that doesn't work. The seminar is going to be, as I said, Thursday, November 7th, 5:30 to 7 at our offices on 500 Fonts Corner Road. Ellen Woods, who is our resident long-term care expert, is going to be giving the seminar. So I don't know if I've answered all of your questions, none of your questions, some of your questions, but wherever you are at this point in your journey, trying to figure out what lies ahead for Medicare, what decisions you need to make, what makes sense for you, don't hesitate to call us. We can set up a reminder if it's 8 months away, or if you're dealing with it right now, give us a call. And you need help with your open enrollment, that's what we're here for. Open enrollment does close on December 7th, so you have the opportunity to, if you're already enrolled in Medicare, to make changes to your Medicare plan between today and December 7th. So there is a limit on that. This is my contact information, and I think that's pretty much it. I'm going to turn it over to you, Vin.
Thank you, Julie, and thank you. Great job toughing it out through the allergy attack there.
Yeah, I'm really sorry.
At some point. No, you did a terrific job. Thank you very much. Thank you for everyone who attended today. As Julie said, we'll be hosting a long-term care insurance seminar here at the office in Dartmouth on November 7th. We'd love to see you there. As for this webinar, we will be posting a blog post by the end of the week, including a recording of the webinar. If you'd like to submit any questions we can answer for you, we'll have a Q&A in there as well, along with some helpful links as you commence with the open enrollment process or any other information on Medicare that you'd like to receive from us. So thank you again for joining us, and we hope to hear from you soon. Thank you.